This young boy is our next follow-up, age 7. He has been diagnosed, the conventional diagnosis, global development delay with microcephaly. Microcephaly is smaller size of the brain. Microcephaly with myopathy, I've been seeing him since last year. We will do a reassessment of the case because we had started the case with Calcaria Foss 200C. We have gone up to 50M with Calcaria Foss. So I like to reassess the case again today so that we can decide on should we stick to Calc Foss or should we go to another medicine. Okay. So কি অসুবিধা হচ্ছে বলো এখন?
এখন স্যার ওই ঠান্ডা তো আপনাকে বলেছিলাম লেগেই থাকছে মাঝে মাঝে।
Catches cold quite easily. কি হয় ঠান্ডা লাগলে?
ওই হাঁচি হয় প্রথমে, নাকটা পুরো লাল করে দেয়।
Sneezing, runny nose, rubs the nose, nose turns red.
আর কিছুদিন মানে তারপরে ওই হালকা ওই হোয়াইট কালারের ডিসচার্জ হয়, তারপর একটু কিছুদিন পরে আবার গাঢ় হয়ে যায়।
Initially it's white discharge from the nose, তারপরে কি হয়?
একটু গাঢ় হয়ে যায়।
কি রং?
সাদা টাইপেরই।
Thick white.
Thick white.
তারপর
এখন যেটা ও তো আপনাকে বলেছিলাম কি খাওয়া দাওয়া এরকমই আছে।
Appetite is low, খিদে কম।
খিদে কম নয়, মানে ঠিক সময় আমরা খেতে দিয়ে দিই। হাঁটাটা আপনার
দেখে হাঁটিয়ে দেখো। দেখার পর হাঁটার পর
একটু ইমপ্রুভ হয়েছিল, কিন্তু যা হয়েছিল 10 to 20% এখন ওই রকম স্ট্যাবল।
নিজে হাঁটতে পারে?
হ্যাঁ, নিজে হাঁটতে
ছেড়ে দিন। Walking has improved 10 to 20% with my treatment, but he feels it stands still for few. কতদিন ধরে একই রকম আছে?
ওই আপনার তো ট্রিটমেন্ট হয়ে গেল প্রায়।
লাস্ট কবে থেকে একই রকম আছে?
ওই সেকেন্ড আপনার যখন হয়েছিল সেকেন্ড।
Since the last few visits it's been standstill with the walking, 10 to 20% better since the start of treatment. একটু হাঁটিয়ে দেখান।
হাঁটা করতে? হাঁটি করো।
ছেড়ে দিন দেখি কি করে। হেঁটে যেতে পারবে বাবা ওইদিকে?
এটাও যেতে
পারবে না?
পারবে, কিছুটা পারবে।
বলুন একটু হেঁটে যেতে।
ওইভাবে তো স্যার বুঝতে পারবে না, কোনো জিনিস ও লাইক করলে সেটা দিকে যেতে পারে।
I'm asking if he can walk a little bit. কি হয় হাঁটতে গেলে এখন?
হাঁটতে গেলে একটু
রিপোর্ট কি আছে দেখা হচ্ছে। আপনি বলুন ওকে ছেড়ে দিন, ওকে বার করতে দিন। হ্যাঁ,
মানে হাঁটতে গেলে একটু স্মুথ জায়গায় ঠিক আছে, বাট একটু রাফ সারফেসে হলে
walking on smooth surface is fine, but walking on uneven surface is difficult.
মানে তখন সে হাঁটতেই চায় না এরকম ব্যাপার।
He doesn't want to walk like that.
আর
Walks with legs apart. You can see both the legs are
এই সাইড একটু ফাঁকা আর
keep space in between. একটু বাবু একটু আপনি ধরে নিয়ে যান না, একটু হাঁটান, হাত ধরে নিয়ে যান। Both feet are separated.
আর ওর পায়ের টোটা তো ওই মানে আমরা যেরকম ফেলি সেরকম না, এই রকম এই টোটাও একটু গ্রাউন্ড লেভেলে টাচ হয়ে যায়।
Speech, কথা বলা?
না, কথা বলা সেরকম কোনো ইমপ্রুভমেন্ট নেই।
Speech hasn't changed at all. খাবার কি বলতে পারে স্পিচে?
ওই আব্বাটাই বলে, আর
Only says abba, which is father.
আর কোন জিনিস ও চাইলে মানে যেটা ও দেখতে চাইছে মানে যেটা নিতে চাইছে যে
ছেড়ে দিন, আপনি ছেড়ে দিন।
ওই যে হুম 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 করে যে সাউন্ডটা করে বারবার, আবার যে জিনিসটা পেয়ে গেলে তখন আর সাউন্ডটা অফ করে
জেদ আছে?
জেদ আছে, হ্যাঁ।
He is stubborn. Whatever he wants to get that. একটু একদম পেছনে নিয়ে যান, ওইখানটা পেছনটা নিয়ে যান। আর কি অসুবিধা বলুন?
আর ওই স্যার আপনাকে বলেছিলাম প্রথমে ও সব কিছু জিনিস এই মুখে এরকম চাপিয়ে নিতে, এটা মাঝখানে একদম অফ হয়ে গেছিল, এখন আবার রিস্টার্ট করেছে। আবার ওই
He was chewing his clothes which had stopped with the medication but again chewing again.
এটা আবার নতুন করে ফিরে আসছে দেখলাম।
আর কিছু?
আর ইদানিং যেটা দেখছি ওর একটু ঠান্ডা লাগলেই চোখের জল আর চোখটা একটু ইচিং হচ্ছে এবং লাল হয়ে যাচ্ছে।
Cold resulting in itching of the eyes. I'm just sharing what he is sharing, so it's not in any particular order, right? Cold resulting in itching, একদম পেছনে নিয়ে যান, একদম পেছনে। Cold resulting in itching of the eyes, চোখ লাল হয়ে যায়।
হ্যাঁ, যখন চুলকায় একটু পর চোখটা হালকা রেড হয়ে যায়।
Itching of the eyes resulting in redness.
এরকম স্যার আওয়াজ করে সব সময়।
He makes that kind of noise frequently at home. আর কিছু?
না আপাতত
ঘাম কিরম হয়?
ঘাম ভালোই হয়,
কোথায় বেশি হয়?
মাথা এবং ঘাড়ে।
Sweat plus, sweat more on the head and neck.
ঠান্ডাটা খুব মানে একটু ওয়েদার চেঞ্জ হলে বা একটু হাওয়া লাগলেই
Cold air or change of weather results in the cold mostly. গলা ব্যথা বলে না।
না ওইসব ব্যথাটা কিছু বুঝতে পারি না।
নাক বন্ধ,
হ্যাঁ নাক বন্ধ আছে,
nose block is there,
নাক যখন
nasal congestion,
হ্যাঁ নাক বন্ধ থাকলে মুখ দিয়ে শ্বাস প্রশ্বাস নেয়,
mouth breathing because of the nasal congestion.
আর রাতে ঘুমটা খুব ডিস্টার্ব হয়, তবে এখন ঘুমটা বেশ ভালোই হচ্ছে।
Sleep was disturbed initially but it's okay now. কিরম ভাবে ঘুমায়?
ও চিত হয় মানে পেটে
Sleeps on his belly, sleeps on his abdomen mostly. গরম বেশি না শীত বেশি?
গরম বেশি।
He's a hot child. Thermals. He's a hot child. জল তেষ্টা?
একটু জল তেষ্টা কম,
Thirst is less. খেতে কি ভালোবাসে?
জলটা জিনিস মিষ্টি জিনিস মোটেও পছন্দ না।
Desire for salty, total aversion to sweets. Desire for salty, total aversion to sweets.
কোল্ড ড্রিঙ্কস খেতে পছন্দ করে।
Likes cold drinks. পেছনে নিয়ে গেছেন? একদম পেছনে? Did you see at the back? Yeah. See the walking, the way of walking. পায়খানা?
হ্যাঁ ঠিক আছে।
Stool is okay. পেচ্ছাপে কোনো অসুবিধে?
পেশাব তো স্যার আগে থেকে আপনাকে বলেছিলাম পেশাবটা একটু বেশি হয়, তো যেহেতু ডাইপার পরে থাকে সেহেতু
Urine is frequent. He's still on diapers.
মাথার তালুটা গরম হয়ে যায় একটু বেশি।
Hot vertex. Head of the vertex is hot. মুখ দিয়ে লালা পড়ে এখন?
হ্যাঁ লালাটা ওই হাত যখন দেয় আঙুল দেয় লালাটাই আঙুলে দিয়ে ঝরতে থাকে, আর ওই তো বললাম আপনাকে
Puts finger in the mouth quite often and that's when the saliva comes out, not during sleep.
না না ঘুমানোর সময় না
পরে বেশি?
এখন আগের তুলনায় বেশি হচ্ছে।
Drooling during sleep is also there. Drooling during sleep is also there, but also in the daytime also there is drooling.
যে এখন যেটা ইচ্ছা আছে যখন বাইরে যাবে তো এই যে আওয়াজটা করছে সবসময়।
He wants to go out, that's why he's making that noise. Normal delivery, he was up to age 12, up to age 12, 3-4 things you must ask while casting. If not, it's a cardinal mistake. Number one, pregnancy history. Anything major emotional, anything major physical, any disease or any drugs which the mom took. I repeat, anything major emotional, anything major physical like a fall, any disease or any drugs which the mom took during pregnancy. Emotional, physical, disease, drug during pregnancy. Number one. If you don't ask pregnancy history up to age 12, it's a grave mistake. Number two, delivery history. Normal delivery, cesarean section, cry after birth. So did the child cry after birth? Was it a delayed cry? So delivery history. Number three, vaccination history. And number four, milestones. And milestones, teething, walking, speech, all separately, because you have separate remedies. We'll talk about that in the discussion session. Specific remedies where milestone is delayed. So milestone meaning speech, walking, teething, all separately you must ask that which one was delayed, all of it or just speech or just teething or just walking. Will give you different remedies. So pregnancy, you got all the points: pregnancy history, delivery history, milestones, vaccination. Please make sure to ask these questions up to age 12. Pregnancy was normal. There is nothing major about the pregnancy. Low birth weight baby, কত birth weight ছিল?
2 কেজি ছিল।
Only 2 kilos. Premature. Time এ হয়েছে?
হ্যাঁ টাইমে
Delivered on time but premature. Not sorry, but low birth weight. Low birth weight. The traveling from a rural area, many times the different tests during pregnancy to assess any damages are not done in the rural areas, to be very honest. Like the screening test is not always done, right? কোথা থেকে আসছেন?
মুর্শিদাবাদ।
কতক্ষণ লাগে?
6 ঘন্টা প্রায়।
6 hours by train
ট্রেন।
to come here. So quite far off. আর কিছু বলবেন? মেইন প্রবলেম কি তিনটে?
মেইন প্রবলেম এখন ঠান্ডাটা একদম অতিরিক্ত, একটু অল্পতে ওয়েদার চেঞ্জ হোক।
Major problem he says he's a father. Number 1 is cold. Number 2
স্পিচে এখন অবধি কোনো ইমপ্রুভমেন্ট,
speech no change as such.
খাবার দাবার ধরেন ও
হাঁটাটা
আছে কিন্তু চিবাচ্ছে না, এটা হচ্ছে আমাদের।
Not chewing food he says number 3, and number 4 is walking. These are the 4 major complaints. দেখি এটা কি অপারেশন হয়েছিল?
না না না, জাস্ট ইকো করিয়েছিলাম।
ইকোতে অপারেশন হয়নি? The echocardiogram mentions congenital heart disease, situs solitus levocardia, and mild bilateral pulmonary artery stenosis. I'll pass it on. বুকের কোনো কষ্ট হয় না? শ্বাসকষ্ট?
না সেরকম না, একটু ঠান্ডা লাগলে তো শ্বাসকষ্ট হয়।
I'm asking if there's any palpitations or cardiac related discomfort. Nothing as such. He had been to a conventional neurologist who has mentioned MRI of the brain is normal, myopathy of the limbs. One of the diagnoses by the conventional physician is nephrocalcinosis. What is that? Anyone? Nephrocalcinosis. Sorry? Medical doctors, please. What is nephrocalcinosis? Kidney. I think it's related with the parathyroid hormone, because the parathyroid hormone, they have done it quite a few times. It's normal though. Sorry? Hypoparathyroidism. Okay.
This thyroid looks slightly, when you look at
the position of calcium salt in the kidney. That happens with hypoparathyroid. মাথায় সাঁড়াশি দিয়ে বার করা হয়েছিল? নরমালে হয়েছে না সিজারে?
না না, আপনার ফোরসেপ ছিল কিন্তু সাঁড়াশি নয়, জাস্ট নরমালি ছিল।
ফোরসেপ দিয়েছিল কেন?
একটু মাথাটা বের হতে অসুবিধা ছিল, ওই জন্য জাস্ট পোর্শনটা কেটেছিল।
This was not mentioned initially. They employed a forceps to bring the head out. এটা তো বলেননি আগে আমাকে।
তো স্যার মানে জাস্ট এমনি একটু কেটেছিল, জাস্ট মাথা।
ফরসেপ দিয়েছিল তো?
স্টিচ হয়তো স্টিচ ছিল ওখানে, দুটো না তিনটে।
ও মাথাটা ফরসেপ দিয়ে বার করেছিল?
মাথাটা ফরসেপ দিয়ে বার করেছিল, তারপরে তো ওই আপনার যেটা ভ্যাজিনা আছে ওইখানে স্টিচ।
There was delay in the labor. দেরি হচ্ছিল বার করতে,
সেরকম হয়নি।
তাহলে ফরসেপ দিল কেন? He's saying there was no delay in labor. Then I'm asking why the forceps then? He's saying not sure, but they employed forceps.
was he upside down or something?
মাথা আগে বেরিয়েছে তো?
হ্যাঁ, মাথা আগে বেরিয়েছে।
No, normal. This is a diagnosis from a leading institution in Bangalore. Just have a read if you can, everyone, and pass it around. This page. আর কিছু বলবেন? মেজাজ কি রকম?
মেজাজ একটু জেদি।
He's irritable, he's stubborn, I mentioned that. ভয় কিছুতে?
পড়ে যাওয়ার ভয়টাই আছে।
Fear of falling. আওয়াজে?
আওয়াজে, হ্যাঁ, বেশি একটু জোরে লাউড কোনো আওয়াজ হলে তখন
Loud noise, he gets startled. পেছাব পায়খানা ধরে রাখতে পারে?
না, এমনি করে দেয়।
হ্যাঁ?
করে দেয়, প্যান্টে করে দেয়।
There is no control over দুটোই পেছাব পায়খানা, no control over stool and urine. He is always on diapers.
এমনি ওকে আধ ঘন্টা পর পর যদি নিয়ে যায় বাথরুমে, তাহলে ও টয়লেটটা করে দেবে। এটা একটা ভালো অভ্যাস আছে। নিয়ে যেতে হবে, এটা কোনো সাইন দিয়ে বোঝাতে পারে না।
See, this is my mistake. I started with calcaria phos. You understand the points of calcaria phos? head sweats, sleeps on abdomen, delayed milestones, especially walking at that point of time, desire salty of calcaria phos, aversion sweet of phosphorus. I repeat. Desire salty you have in calcaria phos, you know that. Now many times you can have some symptoms of the compound remedies, like phosphorus has aversion to sweet. Calcaria phos can have that. Head sweats, calcaria group has head sweats, calcaria phos has head sweats as well, right? For calcaria phos, one of the major milestones which is delayed is walking. You agree with me? So delayed milestones, especially here, walking. Calcaria phos can be stubborn. Very importantly, calcaria phos sleeps on his belly. These are points of calcaria phos again. Head sweats of calcaria, stubborn. Calcaria phos can be quite stubborn. Calcaria phos has delayed milestones, especially walking is delayed. Speech may not be delayed for calcaria phos, but walking is definitely delayed for calcaria phos. Desire salty, and calcaria phos is one of your remedies which likes to lie on his belly. But to be very honest now, if I would have got the history that there was a forceps delivery, I perhaps would not have started with calcaria phos. Because you see, I was not getting a link, because there is no reason how this happened. You understand? There was nothing major during pregnancy, nothing with vaccinations, there was nothing during birth what was mentioned in the initial visit. So that's why let's start with the constitutional remedy. You understand what I mean? But you see, that hasn't helped much. Speech hasn't changed much. Walking maybe 10 to 20% change, but I won't be happy with it, right? কোন সময় ঠান্ডাটা বেশি লাগে?
একটু ওয়েদার চেঞ্জ হলে আর এমনি ধরেন বাইকে কোথাও নিয়ে গেলে।
I'm asking, when does he get the cold mostly? He's saying number 1 is weather change and number 2 is cold air, he gets it, right? When you think of forceps, it could be a head injury, right? Head injury. You're with me? Arnica has that. Natrum sulf has that. Also remember, natrum mur can have that as well. Natrum mur also has etiology from head injury, right? Clark mentions this in his Clark's dictionary under causation section, injuries to the head for nat mur. Please do remember that. Number 4 is Helleborus. It's also superb medicine for bad effects of head injury. And 5th, Cicuta virosa. I'll put an outside note for hypericum as well, although hypericum can cover all types of injuries. But these 5 are my top. Arnica, natrum sulf, natmur, Helleborus and Cicuta for injuries to the head, forceps. Right? You're with me? I'm sharing with you how I'm thinking. Obviously, arnica will be the first choice, first thought, because it covers injuries to the head and whatever be the manifestation. But I'm trying, as he mentioned, I asked the father, what is the major presenting complaint now? What is troubling him the most? He's saying the cold. Cold. The cough, the recurrent cold. I will start today, or I will change today to natrum sulf. Why natrum sulf? Hear me out, please. First and foremost, natrum sulf is a remedy which has head injury. Natrum sulf's miasm, my friends, is predominantly psychotic. And whenever you come across cases where you have change of weather or damp aggravation, remember it's a psychotic aggravation. Change of weather is what he's saying. Weather change is a psychotic modality. So change of weather aggravation, and he's getting a cold. You're with me? In a child who has a desire for salty, all natrum group has a desire for salty. And you see some sulfur symptoms in the case. Whenever he is itching, where he was itching? No, the nose, whenever he is itching, nose and eyes, whenever he is itching, it turns red. You're with me? He has a hot vertex. Anyone has repertory? can you see natrum sulph, does it have hot vertex? Sulfur obviously has hot vertex, but I think natrum sulph also has hot vertex. Okay. He's saying that dust can have an aggravation as well. That natrum sulph can cover as well, dust aggravation. So natrum sulph covers that as well. You see my thought process? If there was no cough and cold, I would have started with arnica. Right? But this tendency for recurrent cold with, more importantly, a change of weather aggravation. See again how myasm is helping you. Change of weather aggravation, psychotic. If you see natrum sulph, I'm sure it mentions somewhere in Alana Boricae, change of weather aggravation. So it covers, see again, covers the head injury or the forceps, bad effects of forceps, if any. It covers the presenting manifestation of cold, which is worse in change of weather. You're with me? And the combination with some sulfur symptoms. Kent calls this as a synthetic prescription. Some symptoms of natrum, some symptoms of sulfur. What are the sulfur symptoms? Whenever it's itching or scratching the eyes and nose, it turns red. Sulfur has that. Hot feeling in the head, sulfur has that. Natrum sulph has that as well. Irritable, yes. You clear with natrum sulph? Happy with it? Again, you see, as I shared with you, learn best from our mistakes. I didn't get that, unfortunately, in the first visit. Potency? Sorry? Okay, take that. Potency? Whenever you're prescribing on the etiology, 2 succeeding potencies, and it's more on the neuromuscular plane, 200 followed by 1M. 200 in the first week, 1M in the third and fourth week. Whenever etiology is there, please remember this, and you do it every single time. 2 succeeding potencies works best. Whenever he's visiting for the next time, again repeat a dose, or if there is improvement, placebo. If there is recurrence, repeat the dose of the higher potency which you gave in the last visit. So 1M was given today, 200 followed by 1M. If and when there is a standstill, I will repeat a 1M again later on. Okay. So 200 followed by 1M of natrum sulph today. I shared 2 succeeding potencies. Why not 30 followed by 200, you mean? Because there is more neurological manifestation. Speech is affected, walking is delayed. So it's more on the neurological plane. And whenever there are more neurological symptoms involved, the higher potencies works best. So that's why 200 followed by 1M today.
Why not Beta-Carb?
Beta-Carb doesn't have any forceps delivery history. So you see, I am trying to cover what was my mistake with Calcaria fos. I prescribed a remedy based on manifestations, not taking care of the etiology. That was my mistake. That's why the patient didn't improve as much as he should. You understand what I mean? That's why any other remedy, lysine comes close. Salivation is there, anger is there, but lysine I won't ever prescribe now, considering I got this history. So whenever you have a clear-cut factor that this may contribute to this symptom, and you see in his history there is nothing else other than this. Although he is not giving much importance to it now, the father, but it's there. It's there. You see in the history which the medical doctors gave, it's mentioned about the forceps delivery. So there you have to incorporate the etiology which you can link with the manifestation. If you don't do that, that was a mistake with Calcaria fos, and you see that's why there has not been considerable improvement. You understand what I mean? So we're going with natrum sulph 200 followed by 1M today. I hope you got the points. History of the head injury resulting in these neurological manifestations with desire for salty, with the hot vertex, and the sulfur symptoms with itching and redness of the nose. I will like to see the speech come and walking improve. You may not get it to be 10 out of 10. I always tell that to the parents that he may not be normal, but I'll make him suitable so that he can do his own deeds, or can do his own activities. He can be self-dependent. But so they're happy with it, because the conventional doctors have given up. They can't do anything. So at least bring back speech. At least say the common needs, stool control, urine control. That can happen. and walking is a little bit better. That's what I want. 200 followed by 1 m for natrum salve. কি এমার্জেন্সি কোনো ওষুধ দিয়েছো যে ঠান্ডার জন্য?
একটা অরণ্য নাকি একটা
চোখ চুলকায় বেশি না নাক চুলকায়? I'm giving him as an organopathic Arando. Have a look in Borike please. Arando, ARUNDO.
এর আগে তো মনে হচ্ছে ওটা দিয়েছে না।
ওটা খাওয়ান, আমি মেন ওষুধ চেঞ্জ করে দিচ্ছি, দেখুন ঠিক থাকবে। You understand why not arnica here? Because arnica wouldn't have taken care of the cold to that extent. Natrum salve can help, and the hot vertex as well. Arnica doesn't have that to that extent as natrum salve. Arando is this, itching in the nose, nostrils. When you have this is ambrosia, itching in the eyes. Have a look at these 2 remedies, put it in your clinical tips for hay fever please. Itching in the eyes, that's more ambrosia. Eyes. And Arando is, if you see in Borike and Arando, it's nostrils, itching more in the nostrils, sometimes in the palate as well, there is itching. So hay fever symptoms with itching in the nostrils and palate, Arando. Hay fever symptoms with itching in the eyes, ambrosia. AMBROSIA, ambrosia. I hope you got the 2. Itching in ambrosia will work better. Ambrosia. Because Arando doesn't have this. Arando is just this area and the palate. No, either nostrils or the palate is itchy. But ambrosia can have this, sometimes nose as well.
But he did have it too now.
Yeah, but I asked what was the more troublesome one. He said that the nose is the more troublesome one. That's why Arando. Arando and ambrosia, you can give it in tincture or 6C. Very good to withdraw the antihistamines. Very useful to withdraw antihistamines, because if the patient is taking antihistamines, you ask them whenever you feel like you need to take an anti-allergic, you don't take that, take Arando instead. You don't take the antihistamine, take ambrosia instead, and that really will help you to withdraw the conventional medicine to a great extent. Try ambrosia, try Arando. If tincture is not available, 6C is equally beneficial.